Money affects health. It's a straightforward and one might think common sense statement. Indeed, 1980s Black Report, 2010's Marmot Review, and 2020's Marmot Review 10 years on all highlighted that health inequalities are underpinned by socioeconomic determinants and that health inequalities are worsening alongside those determinants. The belief that money affects health underpins a huge amount of international development work undertaken by countries like the UK. Yet when it comes to domestic policy, the story suddenly gets shifted from we must eliminate poverty to address health to, well, maybe it's illness causing low income. But our common sense policy group analysis on data from the Understanding Society UK household longitudinal study shows that having a higher income than others is associated with better mental and physical health. Increasing your income is associated with better mental and physical health. It's not just those at the bottom, though, as perceived risk of destitution and other subjective measures are very strongly and steeply associated with health. There are other issues at play. For example, a higher earner may be overcommitted by having a mortgage on which the rate has suddenly spiked, or by having insecure work, which the pandemic showed could be effectively anyone. Even in the 1980s, studies like the Whitehall 2 study of civil servants demonstrated that the higher you were in a position in the chain, the less likely you were to have, for example, high blood pressure, heart attacks, and death. So these are, associations that have been established for a very long time. But I just wanted to show you these charts here. This is what my colleague Daniel Nettle calls a desperation threshold. And this is at the lower end of the income spectrum, below which things get disastrously worse, both in terms of how individuals feel about their income, and that's in the top right box, but also their risk of having clinically significant symptoms of depression or anxiety, and that's right at the bottom there. You can see there's just this point where suddenly symptoms of depression worsen. So that's a really important thing to bear in mind. So in developing policy, we need to keep in mind that we should look for an intervention that ensures people are clearing that threshold and that everyone achieves a level of security that isn't possible from the modern job market. I just wanted to show you this chart too from our analysis of the effect on mental health symptoms at the top and physical health symptoms at the bottom. And this shows that an increase in income, monthly income of £100 at the very lowest end of the income spectrum, about £800, is much more effective in improving health than if you start to increase that income at the top end of the spectrum. It becomes effectively meaningless at the top end. So if that's the case, why should we choose a universal system like basic income over a reformed conditional one? For example, like an increased universal credit. Well, one key reason is that basic income is very targeted. This is an example of a starter scheme of basic income of £75 per week for working age adults, £50 for children, and the existing state pension rate for all over 65s as a replacement for the income tax-free allowance, which disproportionately benefits higher earners. And this would be in addition to the existing tax and benefit structure generally, with a very small increase in income tax rates if we wish for it to be fiscally neutral up front. It's a starting point on a pathway to a full minimum income standard basic income that we set out in our book Act Now. Even this starter scheme results in the lowest poverty and inequality rates since at least the mid-late 1970s, when they were at their lowest. For child poverty, though, it's the lowest since comparable records began in 1961. It achieves more than New Labour's efforts in the 2000s, but it's more efficient. And by also protecting people in work, it's much more difficult to undo. So for health, this is huge. This slide shows our basic income model of health impact with three big pathways shown from intervention to outcomes. Basic income reduces poverty, it mitigates the inequality that makes essential costs unaffordable for us all, and has subjective effects too. And it provides predictability and security, which promotes long-term thinking and investment in healthy living. This is of benefit to everyone and shown to be essential in a post-pandemic world. Crucially, it removes the perverse disincentives from being healthier and more economically active that are inherent in means and needs tested systems like universal credit, personal and independence payment. It's quite simply the perfect multi-purpose policy solution for our times. And the benefits could be huge. We used microsimulation modeling of just the changes in income that would result from the three basic income schemes. So that's a starter one, an intermediate one, and a full minimum income standard basic income. And we combined that with our analysis from the Understanding Society data. This doesn't even incorporate the security that basic income would provide, but on the basis of this analysis alone, we think that the schemes could prevent or postpone at least hundreds of thousands of cases of depressive disorders and physical health problems each year, and around 1 million when we get to the minimum income standard scheme. This provides huge returns on investment in terms of the hundreds of thousands of years in good health that we would gain. And under National Institute for Health and Care Excellence guidelines, they would be valued at between 4 and 20 billion pounds. And when you look at direct health cost savings, we're looking at least 100 million, hundreds of millions of pounds per year, but 4.5 billion under the minimum income standard scheme, when the costs that patients bear are included. This would cover the cost of more than 60,000 nurses in hospital. Welfare as public health is really just common sense. We've seen a huge reduction in the public health grant over the last 10 plus years, and cuts have been worse in the most deprived areas. Public health interventions in the midstream, like smoking cessation and weight loss, cost just £3,800 per year in good health per years in good health gained, compared with 13,500 from reactive services. Providing services for the entire rest of people's lives can never be as effective as eliminating the cause. Poverty costs everyone, particularly the public purse. But importantly, this isn't just an academic pipe dream. Basic income is popular both in the Red Wall and nationally. In the Red Wall, it had an approval rating of 71% overall, including 62% of 2019 Conservative voters. And we know that narratives that emphasise the security it can provide improves its perception among the small number of strong opponents. There's no reason why politicians can't get people to vote in their own interests. The benefits that basic income provides are enormous, and they cover so many areas other than health. When you look at it as part of a package of whole government reforms that we set out in Act Now, which emphasise a shift away from rewarding passive wealth and towards prioritising productive work, there's suddenly a clear pathway to national renewal and success beyond even the previous high points. We can eliminate poverty while driving growth and employment at the same time, but we can also address the net zero transition, public utilities, crime, education, housing, and public transport. Basic income sets a foundation for all of this. It really is the common sense policy that changes everything. Thank you.